Hello, and welcome to the Texas System of Care Cultural and Linguistic Competence Podcast. My name is Shannon Moreno, and I'm the CLC, or Cultural and Linguistic Competence Specialist with Texas System of Care. This podcast is devoted towards how to work with specific populations within your local system of care community and ensure that you're providing services that are culturally and linguistically appropriate. This series is focused on working with youth who identify as LGBTQ+ and their families. For a further explanation of CLC terminology, including terms used in this podcast, we recommend checking out the ABCs of CLC webinar series. We continue the conversation with Sarah Kapostasy, Clinical Services Director at Out Youth in Austin, Texas. So Sarah, something else that I have heard from genuine concern from people of trying to not do the wrong thing is how can youth, or in some cases even children, know things about themselves in regards to sexual orientation or gender identity? And a lot of times when I've heard it from clinicians, it really does come from a place of how can kids know this? And we're possibly going to make major changes, or at least this is, what is going through the thought process of this, starting to refer to this person as a boy or as a girl when that hasn't been the case for the first portion of their life. How can they know? What if we encourage all these major changes in the life of this family, and then what if as an adult, they realize that was all a mistake? Or in the case of sexual orientation, how can a 10-year-old possibly know that, they're not a sexual being yet? How can this possibly be the case? Must just be influenced from society, from TV shows, that type of a thing. Can you kind of speak to that a little bit as far as, childhood development and what you have seen as far as whether or not youth can genuinely know these things about themselves?
Mm-hmm. Yeah, it's a great question, Shannon. I appreciate you asking it. And I guess I'll start by saying, and I really don't want this response to seem flip or callous, but one way that I often invite folks to think about this issue is if you happen to identify as heterosexual and cisgender, how did you know? How were you sure? And so that sometimes gets people into a frame of mind of I just was and I just knew. And I'm same goes. So that's the first way I would answer that question. And I think it's just a nice exercise for folks to sort of step into themselves and sort of think about their own development in that way. And because it was the normative, and I'm using air quotes there, of the culture, didn't necessarily have to think about it maybe quite as much or question it, but it was still something that people who are heterosexual and cisgender knew about themselves and thought about themselves over time. So that's one way I like to kind of think about it and talk about it. The other way I like to talk about it is just what research shows us. And I think with this, I'll focus first on trans-identified kids and adolescents, but I'm happy to talk about this in terms of sexual orientation as well. One thing that I would point to is the University of California at San Francisco has some lovely standards of care for trans folks, and it's out of the Center for Transgender Excellence. And so you can find these guidelines really easily. There's a wonderful standard of care guideline for children and adolescents that was co-authored by Joanna Olson-Kennedy, who's a wonderful doctor out in California, who was just at a conference that we held here in Austin recently. And it makes really clear that while research is relatively new, not that trans folks are new, but visibility is new, ability to identify and connect and affirm one's gender in certain ways are developing, and research is developing in this area. At the same time, some of the research we have basically shows that a kiddo does not have to have a fully formed prefrontal cortex to know their gender identity. That's just bottom line. And that kids can vocalize information about their gender identity at incredibly early ages. And so one thing I also want to talk about here, not to get too nuanced, but this is something that I feel a little bit passionate about, so I want to chat about it a little bit, is that I'm so glad that there's been increased visibility in the media, particularly for trans folks and also for trans kids, right? So there's been, some really high-profile folks, like Jazz Jennings comes to mind, and they're doing incredible things in terms of raising awareness. I think one thing, though, that's hard with any group that might be a little bit marginalized is that because there's not a lot of representation, that becomes like the one thing, right? So in our culture, I think there's a decent amount of awareness of trans kids and kids who knew from the time they were 2 or 3 and, were, if they were a trans boy, like they were playing with trucks right away and asking to wear pants and, vice versa. For trans girls, they were always into pink and, had these dollies. And that's certainly the experience of some trans kids, some trans people. Like that's how they start their journey with gender identity. And so, the good research shows that for trans kids, those that are affirmed in their gender, parents who allow them to express their gender in ways that are authentic with their identity, they have much better mental health outcomes. So a recent study that was done by, I believe it was the American Association of Pediatrics. I could be wrong on that. We might have to edit that out. But so there was a recent study done that shows if kids are allowed to express their genders in the way that they are vocalizing and verbalizing what their gender is at that time, then they have similar rates of anxiety and depression as their cisgender peers. And that's huge because we know there's also research that if folks are not validated in their gender identities, there can be very different outcomes. So that's a little bit about trans kiddos. One thing I also want to say, though, because I primarily work with folks who are 12 and older, is that there's another narrative. And by the way, there's a million narratives about the trans identity. There's as many narratives as there are trans people, is one thing I've learned in clinical practice. And another theme that I want to highlight is that there's this thing that's very real that is onset of gender dysphoria at and after puberty. So that's another narrative I really want to highlight because, and I understand it. I get parents coming in and they're like, well, like this like is completely out of the blue for me. Like all of a sudden my kid comes to middle school and they're starting to express these things about their gender and I just didn't see it before. And in some cases, maybe they didn't see it because the kiddo was hiding it because our culture tends to be pretty transphobic and, kids may protect themselves in certain ways. Or the kid really didn't feel the strong sense of dysphoria until the development of those secondary sex characteristics. And physical dysphoria is just one type of dysphoria that folks may experience. But for some of the kiddos I work with, that's when it really becomes super clear to them. So that's something else I want to say, just kind of to this, question of can people know, when do they know, and, there's a variety of ways that can play out over time. So that's for gender identity in particular. And I think, it's a similar story with sexual orientation. Folks, as they grow up, they may have certain feelings at certain times. You and I were talking before the podcast about, you may be in kindergarten and get little butterflies in your stomach, and that's not necessarily sexual attraction, right? But you're feeling something there, right? And I think a lot of folks can sort of resonate with that experience of, because it's who you are. And that's something I say a lot too, as I talk to folks in the community about this, particularly when it comes to trans adolescents. And I mean this at a deep level, and I think it's going to come off as like maybe obvious or maybe not the way that I'm intending. But I can tell you, sitting in the room with client after client, talking about their gender identity, like really working with like who they know they are, sort of like down to their soul. I know that's who they are because that's what they tell me. And that's the bottom line for me. And I just tend to trust my adolescents, and it's not easy. It's such a difficult thing to come to, especially if it's a marginalized identity, right? Like, a lot of them don't want it to be true, is the other thing I definitely see clinically. It's like, oh, let this be anything else, right? You know, some of my kiddos certainly, again, everybody's narrative is different. Some are very proud and they're very out, and, you know, their trans identity and or their sexual orientation identity is super important to them, and they wear it on their sleeve. But for some of my kiddos, it's a really painful thing to come to terms with. And I just feel really honored that kids do vocalize that with me, and they work out, you know, their concerns about coming to terms with that identity with me, and that I can provide some support and try and advocate that those around them provide support.
If a young client tells you that they identify differently than the sex they were assigned at birth, does that mean surgery and hormones tomorrow?
That's a great question, Shannon. Nailing it. So here's what we do at Out Youth right now. We definitely chat a lot about gender identity with a lot of the clients that we serve, not with all. And for some folks, we chat about gender identity, and folks decide that they identify somewhere under the trans umbrella, but no medical intervention is necessary for that. They feel like, you know, I've socially transitioned, my family is using they, them pronouns, my teachers are using they, them pronouns, my friends are using that, I'm allowed to dress in the manner that I feel most comfortable, and that's cool for me. Like, that makes me feel validated in my identity enough, that, and I feel enough comfort with my life and with my body and with how I am socially, to leave it at that. So that's the experience of some of the kiddos that we work with, some of the adolescents. For others, though, the dysphoria, the emotional dysphoria, the physical dysphoria gets to a point where it definitely causes some things that are co-occurring or exacerbates things that are co-occurring, such as anxiety and depression are two really common ones. And so because of that, we go through a bit of a process, and I do ask for parental consent before I go through the formal process of looking at whether a youth meets criteria for gender dysphoria as outlined in the DSM-5. And the process I go through with youth is twofold. First, I invite them to do a gender timeline, which is exactly what it sounds like. It's basically their reflection of their gender over time. So they start from kind of their first memory of their own gender, or just when they realized gender was a thing. And then they kind of take it up to the present day, and we talk through that a little bit. And then the second part of that is asking a bunch of questions in different areas around gender affirmation. So, you know, what are your thoughts or your goals around, you know, anything physically that you might want to see change? What social and emotional support do you have if you're going to move forward with this? You know, socially, what's it going to look like to come out? And, you know, some of my youth have already, by the time they get to me, have come out to pretty much everybody in their lives that matters. And so we even talk about, you know, but putting yourself forward into the future. Like, what is that going to look like? So throughout that process, I get to do some psychoeducation sometimes, some skill building. But here's what I'll say is that most of the kids that I work with have done all the research by the time they get to me. Like, they know a lot about this process before they even hit my door and before we even have these conversations clinically. And that's my experience most of the time. So we go through that particular process, and then we talk about options, right? And one thing I say to parents a lot, and we do some work with parents, and I like to say that, kids and parents are on separate yet intersecting journeys throughout this process. I found that, parents definitely have their own process that they go through, and we want to certainly provide support for them around that, and recognize that this is an impact on the family, and decision about any sort of medical intervention is a family decision. Especially because if you're under 18, your parent or guardian is the one who consents for any sort of medical intervention, right? So, we definitely talk with the parents. We work with them. We meet them where they're at. Parents come in various places from, I'm not sure at all about this. I want my kid to be happy and healthy, but this is just completely new to me, to I've done all the research. I know my kid needs a letter. Let's get my kid a letter. So it's a huge range. And by letter, I mean letter of support for any sort of medical intervention. For the most part, especially, for youth in particular, they do need a letter from a therapist with a diagnosis of dysphoria. That's changing a little bit for adults, and we're moving a little bit more towards an informed consent model where a trans person can make that decision with their doctor. But we're not there for youth yet. So sometimes parents come in and they're raring to go to get that letter to move forward with certain interventions, and sometimes we've got a little more work to do. And one thing I like to say is that the decision not to start hormones is not a neutral act. So, and I understand it, like I'm a parent too. And I try to bring that perspective and that empathy into the room with me as parents are navigating these really difficult decisions. It feels like a lot. It feels like a lot of weight on their shoulders. At the same time, I've seen enough clinically of how treating dysphoria, it's not a straight line, and I'm really clear with parents and kids about this. It's not a straight line. Like, this is not going to cure your depression forever and ever. At the same time, I've seen enough clinically of how it really alleviates a lot of those symptoms to the point where, the health and wellness of that youth is so promoted that, I just share that with parents. And I talk about some of the benefits that I've seen in moving forward with gender affirmation, whether it be hormone replacement therapy, which is how a good amount of kiddos start this process, or through certain surgeries to help their gender identity match their sex assigned at birth. So you can see I can talk about this a lot. I can talk about this all day. I think that answered the question. But yeah, it's a really it's an interesting process. It's a fascinating process. And one thing I say too, in terms of kind of back to your original question of like, how do kids know or how can they be sure? I'm like, would kids really jump through all these flaming hoops of fire if they weren't sure? Like, that's one thing I think about a lot too. Would they sit with a therapist for the time it takes to go through this process? Would they advocate with their families the amount they have to advocate? Would they, go out of school and find a doctor? Like, all of these things, it's not an easy process. It's not like, oh, I woke up today, I decided I was trans, I made a doctor's appointment, and I'm on hormones now. Like, that's just not the way the process works. So I guess that's what I would say about that, and specifically to as it relates to trans-identified adolescents.
I'm so glad that you brought on the piece of working with parents and how you'll see parents and you'll begin to interact with them at different places. And I love what you said about you meet the parents where they're at. Yes. And I think that that's another misconception about working with youth who identify as LGBTQ+, is there seems to be this sentiment that if parents are not 100% accepting from the get-go, then it has to be this dichotomy of like, well, how do we either, it kind of depends on the situation, but I've seen sentiments of, well, the youth just has to deal with that and continue, fitting in with their family and deny this portion of who they are. Or there's sometimes a sentiment of this dichotomy of, well, the parents are wrong 100%, the youth is right 100%. So we just need to kind of deal with the parents and make sure that this youth makes it till age 18, and then they can just peace out, say goodbye to their family, and then have this wonderful life, just within their LGBTQ plus community. And of course, both of those scenarios sometimes unfortunately very much do happen. But as far as clinicians being a piece of that and the health and wellness that we want to promote within youth and within families at large, do you see any validity to any of those? Is it sometimes situational, or is it always the end goal, the hoped goal of still out of this process having the youth have their family and having validation and having connection there?
Yes, absolutely. And I think, as we pull out and look big picture, of course, we know, the importance of cultural connection with the family as well. And that's another part of somebody's identity that we certainly don't want to discount, right? So one thing I'm thinking about as you speak about this, Shannon, is the work of Caitlin Ryan and the Family Acceptance Project. So the research and the materials are a couple of years old now, but it's a resource I really like for those families where, first of all, I praise the heck out of them because they are allowing their child to go to out youth in the first place, right? Like, that's step one. Like, that's huge. Like, even, kind of allowing them to connect in the kind of social space that we offer. I think that's so amazing that parents are willing to go there and allow their kids to, come and hang out with us in the space. And also acknowledging, like, that might not mean that you're ready to, like, march in the pride parade and, like, throw a ticker tape parade, like, my kid's gay, woo! Like, that's not where everybody is, especially initially or even, a year or two down the road after a kiddo comes out. It sometimes takes some time. And so what I really like about what the Family Acceptance Project does is it says, you don't have to throw your kid a ticker tape parade. Like, you don't have to be the president of PFLAG. However, here is what you can expect if you full-on reject your child. Like, here's their increased risk for suicide. Here's their increased risk for substance use over time. Here's their increased risk for developing depressive symptoms. And that's with, like, full-on rejection of the kiddo and their identity. And so a lot of times what I find with parents who, are on the journey or starting the journey are struggling with it is, sometimes presenting some of that data and saying, right now, if you just don't outright reject your kid and this aspect of your kiddo's identity, then we can work from there. And even if that's the only place that you get to is a place of not full-on rejecting your kiddo, then the benefits to them and their mental health and wellness are, you're giving them a better chance, right? And so that's one resource that I think about. And I think, we've got to have a balanced approach with parents. And, I will own and say that out youth can be a pretty radical space in a lot of ways. Sometimes we're in a little bit of a bubble, I would say, about this. And, our organization was founded on a history of social justice and pushing and advocacy. But for me, from a clinical perspective, I think it's incredibly important for me to hold space for folks wherever they are. And, if they're not at that place, just giving them some gentle education, resources, and honestly just allowing them to come and talk it out. That's what I found is most helpful, especially initially, is I just invite the parent into my office and I say, hey, let's talk about this. How are you feeling? And, kind of going for those feelings first, really expressing some empathy, and then sort of taking it from there.
I hope you enjoyed today's CLC podcast. If you have any questions on how to bring CLC initiatives into your local system of care community, please feel free to email us at info@txsystemofcare.org.